taken my son to a soccer game, and as I was sitting there, I was kind of leaned forward and I had my arms on my knees, and I noticed my whole left arm went completely numb. And as we were leaving, we were in the parking lot and I just collapsed. I don't remember a whole lot at that point. I just remember I had no feeling or movement on my entire left side.
I was home by myself with the two youngest kids. I went to the ER in Norfolk and remember walking into the ER, and it was scary. She was laying on the gurney and she was completely paralyzed on her left side, 100%. Couldn't move, couldn't feel anything. She had facial droop and just bad. You just don't expect to see your wife, who's 32, having a stroke in the ER.
She was in a unique situation because she had just delivered a baby. So because of her postpartum state, there was an issue of whether she could be treated like other people are treated. I think what happened back home was they recognized she's having a stroke and she's not going to be a candidate for the usual sorts of therapies. So we have to figure out, is she going to be a candidate for more advanced therapies that aren't widely disseminated? You can't just get the drug and give something else. You're going to have to move her, and the choice was then to move her to the med center so that we could see if she would be a candidate for the alternative therapy. Are you going to do a procedure where you're going to go through and go up into the arteries and try and open them, or is that not in her best interest? Will that make the problem worse? That's the critical decision-making issue, where we start getting access into the groin, very similar to somebody having a cardiac catheterization who's having a heart attack. And then what you do is you inject dye into the carotid arteries and the vertebral arteries. And what you're trying to do at that point in time is simply figure out the roadmap. What's blocked? What's not blocked? How is the brain being fed with blood? Which parts aren't getting blood? What we initially did was went up, we got through, we put some medication, TPA, into the blood vessel to have that start working to break down the blood clot that had gone up into the blood vessels of the brain. Then we went back down into the blood vessel of the neck where the blood vessel was blocked, and we worked on opening that up. What you're shooting for is good enough to either limit the size of the stroke or eliminate the stroke altogether.
She was already in surgery by the time we got here, and waited in the waiting room with some family, and it was just terrifying. I went to school here, so I kind of know that this is a place to be.
Once we figured out what was happening, we started the anesthesia part of it, getting the blood pressure up. We got through the blockage. We gave the lytic medication that helps open up the blood vessel of the brain, and then we started working on the neck. And once we have that done, the procedure's done. So then the next day, you can see that she's starting to move her arm, and you get another picture and you can see what size of her stroke. And the size of her stroke is small, something that's pretty recoverable. And that's the way it's actually worked out. She basically has no deficit.
I remember walking into the room and she was still intubated, and she was moving her left side because she was agitated because she was intubated, of course, and that was amazing to see that after what we had been through. Because I knew at that point she was probably going to be okay.
We have worked since 2003 for building the expertise, the training, the organization to bring consistency to the care of patients with stroke. The Gold Plus Award that the American Heart Association has awarded to us is certainly a big signature, essentially, to the care that we provide. What does it mean? It means that somebody else from the outside is able to not only measure what we do, but measure it and compare it to other centers around the country. Is telling us that you are doing a great job at keeping the level of care to where the standards are today, based on the latest evidence, latest research, in order to coordinate all of these efforts and making sure that it happens is by itself a prowess that we should all be very proud of.
It's pretty amazing.
it took a whole team approach, and that's how it is in medicine. You know, it's not just one person that saves the day. It's always, you know, from everybody from the receptionist to the nurse to the doctor to the physical therapist. It's a team approach, and that was really evident in Nicole's case, where, you know, not even the same team at the same hospital. It's just, you know, the healthcare community really came together, and really was outstanding.
I'm fully functioning like I was before. I have very minor deficits that most people wouldn't notice and don't bother me one bit. The nurses were amazing. You know, with, like I said, everything with my home life and all of that was going on at the time, they really, you know, provided that physical and emotional support that I desperately needed during that time. And, you know, words can't express my gratitude and appreciation, not just for Dr. Thorell, but for, you know, all of the nursing staff and other staff, the therapists that, you know, kept me going every day. And, you know, it has been the most positive experience that I've had with a hospital. My family and I will forever be grateful for, you know, the care that we received here, and I mean, it was life-changing.
If it wasn't for Dr. Thorell and the nursing staff and everybody, I mean, my kids would not have the mother that they have, and that's amazing.